Hello, I'm Louise from the Hep C U Later programme, and today I'm going to show you how to complete your self-testing for Hep C, HIV and Hepatitis B using the dry blood spot kit that you will have been sent. So you will have received an envelope like this. Inside you will have a yellow testing form which has got a bag on the back for us to put the test in, a little bag with a test card, 2 alcohol wipes, 2 plasters and 2 lancers and some silica gel that we're going to leave in this bag. You'll also need some soap to wash your hands, either a tissue or a cotton wool ball to stem the blood afterwards, and something to dry your hands. So before we start, we're going to fill out the yellow test card. So today's date is the 4th of July, so we're going to write that in. And the time collected is 10:25. The clinic number, we're going to put exchange supplies. Don't worry too much if you forget that. The most important thing is your name. So last names first. So as this is a training, I'm going to call myself Jane Doe. And then my date of birth, I'm going to put 01/01/1985, and then I'm going to tick that I'm female. So the tests that we're going to do are hepatitis C, hepatitis B and HIV if you deem that you've been at risk for it. So the reason for testing, so we can tick number 2, which is risk group, and the history of exposure. If you identify somebody that's previously been an intravenous drug user, you can tick number 1, or if you're currently injecting, number 2, or any other of the risk factors. If you're unsure, then you can just tick number 6. So it's really important that the name on the dry blood spot card matches exactly the same as on the testing paperwork, otherwise it won't be tested. So we're just going to make sure that both of those are correct, and then we're just going to lay this over there ready for us to do the test. So we're just going to wash our hands thoroughly. If you don't have access to soap and water, then you can use the alcohol swabs to be able to do that. So I'm just going to dry my hands ready to do the test. And when your hands are dry, we're going to choose the finger and take the lancet. So what we're aiming to do is fill up each of these 5 circles with droplets of blood. So it's good to prick the finger there so that you can just drip it. So if your fingers are a little bit cold, then maybe just try milking your finger like so. And then we're going to just take the lancet. It's a single-use lancet. And as you can see, the blood drop is starting to form. So what I'm going to do is just get this ready. Now, it's really important that you don't touch the paper with your actual finger. And if one of the circles doesn't get completely filled up with 1 drop, you can use a 2nd drop. Once your 5 spots are filled up, use your cotton wool or your tissue just to stem the blood flow. And as long as you're not allergic to plasters, just get your plaster out and pop it on. The sharp lancet can just go in the normal domestic waste bin because the actual blade is pulled back into the device. So that once done, we leave this for 20 minutes to half an hour until the spots are dry. It's good to just make sure that the blood has gone completely through the card. Once dry, we're going to fold this up. We're going to pop it in the envelope with the silica gel. We're going to take our testing paperwork, and in the back is a little pocket. We're just going to pop the test in its bag with the silica gel into the bag in the back. We're going to fold this over, fold it in half, pop it in our grey self-sealed envelope, seal it up and pop it in the normal post, and the results should come back to you within 10 working days. Thank you very much.